That's everyone's reaction so far.
Okay, it's recording.
I guess a good steady. How do you make it?
Oh, but now that they're gonna see in the recording. Is there a way to change it?
The slides.
Oh, they will. They'll see that.
Yeah.
Okay, cool.
Super. Okay.
Okay.
All right. Well, we're really pleased to have Emily Hecker here, who is a graduate from our program in 2019. And Emily is now an evaluation specialist at the Evaluation Center, where she uses her ethnographic and qualitative skills in her work every day. For those students who don't know, evaluation is a burgeoning field that employs a lot of our graduates. So thank you, Emily.
Hi, everyone. So nice to be here. So yeah, I'll just be talking about my experiences with like social science research and anthropology and how I'm using it in program evaluation now in my career. So just going to talk about kind of first my experiences in the program here at CU Denver, talk more about like what program evaluation is, and then talk about the organization I work for called the Evaluation Center, and then some of the current projects that I work on. But I also first wanted to start with like a little bit about me as a practicing social scientist, having been trained as an anthropologist. I have to acknowledge my worldviews and the lens through which I view my relationships and events in life. And I'm always cognizant of how this impacts my work through my own biases and through how people may view or interact with me when I'm collecting data and collaborating with folks. This is one thing that the anthropology program taught me that I've brought with me to my career and the organization I work for. That is called like the reflexivity exercises or statements. We do that a lot where I work. So I'm always thinking about how my own biases impact my work and how people may view me. So yeah, I am married to an Ecuadorian immigrant, and this experience and other ones earlier in life has just made me really passionate about immigrant rights. I am the mom with a toddler, which is huge. I love being outside. I'm really passionate about environmental justice. I've been with the Evaluation Center since 2018, and I graduated from the Medical Anthropology program in 2019. I also just want to throw out there, I love a good movie or book, and Project Hail Mary was chef's kiss for both of those. Just want to throw that out there. Okay, so first of all, talking about my experiences in the master's program here. I focused on learning about the social determinants of health and specifically how policies and immigration status and socioeconomic status and work status and discrimination all impact health and well-being. So here's some of the things that I learned in the program that I use regularly in my career. One of the activities I got to do or projects I got to work on through the Medical Anthropology program was at a group project at a federally qualified healthcare facility. We were looking at how immigration status and work status impact access to healthcare. So we did literature reviews, we developed an interview guide, we interviewed in person at the healthcare facility. We got to do some qualitative coding. It was a group collaborative effort. So there was 3 of us on the project and we wrote up our results. So these are all things that I do regularly where I work now. I also learned about stats and social science and learned how to use SPSS and Excel. I use those both daily. Report writing in general, we do that all the time. I'm always applying theories and frameworks to real world topics and projects. And I think a huge thing that this program gave for me was increasing my knowledge and critical thinking around issues related to equity and social justice. The other thing I did in my master's program was I got a certificate in Latino public health. I did this instead of completing a thesis. So through that experience up at Anschutz, I worked on a community health assessment and did interviews and surveys for a local Department of Public Health. We also collected secondary data and which is publicly available data about the area and health indicators. So that's something I do regularly as well. Just learning more about social determinants of health generally, but specifically among the Latinx populations and communities. And then another hands-on thing I did through the certificate in public health was my final project was a program evaluation for an organization called Vuela for Health. So I analyzed survey data that they collected for their culturally responsive diabetes prevention program, which was specifically catered for Latinx populations and immigrant populations in Denver. The survey had pre and post Likert scale questions and open-ended questions, which we use a lot in evaluation. I got to meet with program leaders and staff members. I did site visits and reported findings to the organization. So all things that I do all the time. Okay, so talking more about what program evaluation is. So really who it's for is for anyone who has a program or a project with goals they're working toward. Many grant funders require an evaluation be part of the funds that they provide to agencies. Usually somewhere around like 5 to 10% of funds are used for evaluation or monitoring. Different agencies that regularly do evaluation are government agencies, like public health departments, researchers, especially those who get NSF or NIH grants often need to provide an evaluation. A lot of community programs and nonprofits do evaluation work, foundations when they're providing funding for different folks, and then schools, colleges, and universities also often do evaluation. So what evaluation does is it helps answer specific fundamental questions like, is my program or project meeting its goals? What's working, what's not, and what needs to change? And then how do program leaders and staff show to funders and their communities the impacts that their programs are having? If you have an evaluation, what you're hoping the outcomes are, what it provides to you is uncovering if a program worked as it intended, or if there's anything else too additional that might come from the program that you weren't expecting, good or bad. Thinking about how you can improve the program. It helps you gain evidence about the program's effectiveness to share with communities and funders, like I said, and provide new insights or new information that's not anticipated. When it's done effectively, it really just allows projects and staff and programs to tell their story with confidence and prove their worth. A lot of times you'll hear like nonprofits or programs anecdotally saying like, we hear people talk about this all the time and how amazing the program is and the impacts it has, but they don't feel like that's data. So we're kind of like helping them be like, no, that's data. We'll help you tell your story with confidence and like collect it in a way that is like rigorous and what they would consider valid. You also want to always engage multiple perspectives, including like the staff members, community members, program participants. And the hope a lot of times is to build capacity and prepare organizations to like continue the evaluation even once you're done working with them. So yeah, really it just supports organizations to secure funding, improve programming, recruit for their programming, and tell their story with confidence. Okay, I'll do this one more section. If there's like any questions, we can do questions before I move on to the next section. So thinking about like what an evaluator does day to day, more in general, we often help program staff develop a roadmap of their programs so they can understand how the activities they're doing align with the goals and to help think through how they're going to achieve those goals. And then also assessing progress towards the goals and collecting data to determine if changes or adjustments are needed, or collecting data to provide evidence of quality and effectiveness of the program. We always talk about an evaluator being a critical friend or a thought partner to our clients. We're like an outside voice that can offer insight. We always talk about it as being like our clients are experts in their programs and we are just the experts in evaluation, but we both have stuff to learn from each other. So it's definitely an ongoing like learning and teaching forever opportunity. Common evaluation activities, we use similar skills to social science research and all of the work that I did and learned how to do in my master's program. But evaluation focuses in on a specific program rather than just broader social issues. That's really the main difference. I guess the other big difference is that it's usually a lot faster than traditional research. Some of our evaluations only last for a few months, but then others are still ongoing over many, many years. But we do conduct a lot of literature reviews. We design and plan evaluations. We develop data collection tools, like surveys and interviews and focus groups. We do all of those things all the time. We do journey mapping. We gather and interpret publicly available data. Usually for public health or education related programs, we do that for. We're triangulating different data sources into clear and concise concepts. So we're triangulating data from our interviews, our surveys, publicly available data, our literature review. We also tailor our findings, we tailor the communication of our findings depending on who we're reporting to. If we're presenting to program staff, if we're presenting to their funders, maybe NSF or NIH or public health agencies, we'll kind of change the format and language to just make communication more available. And we share more about like what can be improved in the program to program staff, and more of the like positive benefit successes to different audiences and communities. Let's see. Yeah, and we do the same with data visualization. So sometimes data can be presented differently. So we think about like different ways that we can present data depending on who the audience is. And then we also help generate recommendations for improvement or engagement. There's also different types of evaluators. So there's internal evaluators who are embedded into organizations, like their full-time job is to be an evaluator for programs within that organization. That's usually like foundations or hospitals. Public health agencies have them a lot. There's external evaluators who are contracted by different organizations and nonprofits, or contracted to be consultants. And then there's also just staff members with multiple roles who do evaluation. We see this a lot in nonprofits who just don't have enough resources or capacity to have like a full-time evaluator. So they'll kind of have the evaluator role be in with like a program manager position or a grants and contracts position. Internal evaluators usually have I've never been an internal evaluator, but I've heard people who talk about it as like benefits being, you like really know the staff and the community members. You're really intimate with like the projects and programs, you know exactly who's working on them. You've met community members. You're working within the system, and you usually have like more time and budget to do the evaluations. External evaluators, on the other hand, have the benefit of seeing programs through like a fresh lens, like maybe a little bit more objectivity. Our budgets are usually, the downside about external evaluators is budgets are usually stricter, and there's just less time, and you have to build the relationships from scratch, which relationships are like very important in evaluation. Okay, any questions before we like talk about TEC and the work I do?
I have some, but I'll save them.
Okay. Okay. So moving on to the Evaluation Center, which is where I work. So TEC is located in the School of Ed and Human Development at UC Denver. We're not physically located there. Our offices are off campus, but we're housed within that school. Our team consists of 17 part-time and full-time staff members, in addition to 3 graduate students. There's many different backgrounds at the organization I work. We come from fields like education, public health, business, public policy, sociology, psychology, and then there's a couple of us from anthropology as well. Our organization is 100% grant and contract funded. So that is something we deal with all the time. We're very cognizant about. So for our projects, right now, I just counted, we have 27 active projects. I work on at any given time between like 5 to 8 projects, depending on like my time and capacity. We support organizations and projects that are large and small across like very many different disciplines and content areas. Our projects can range from like a few $1,000s over the course of like a couple months to 500,000 a year, spanning multiple years. So we do it all. We definitely like supporting whoever needs and wants evaluation services. We also take a team approach to staffing our projects, drawing on the capacity and strengths of the individuals on our team for like who's the best at doing certain things or who wants to learn how to do certain things. And then also just like who has the time. And these are just kind of a few examples of some of the folks that we work with. So we work with the CCTSI, which is the Colorado Clinical and Translational Sciences Institute at Anschutz. We have a lot of work with them demonstrating how their programs are impacting researchers up at Anschutz. We work with a group doing technology for cancer supportive care that provides trainings to folks who work in cancer care to increase their tech and ability to use tech in care. And I think that's an NIH funded program. We do work out of the College of Engineering. We have a lot of work with the Department of Public Health and Environment. The Colorado Consortium for Prescription Drug Abuse Prevention is another one that we've done a couple of projects with. And then an example of a community project is the Developmental Disabilities Resource Center here in Denver. Okay, so a few current projects that I'm working on right now. One that I work on is the Community Reinforcement and Family Training Program called CRAFT. It's funded by SAMHSA through the State Opiate Response Grant. This grant provides funding to states specifically for treatment and prevention of opiate use disorder and overdoses. This is an example of a federally funded grant that does require some level of evaluation and monitoring. So the BHA manages the grant and they're required to hire and contract with an evaluator to do some form of assessment and monitoring of the grant. And CRAFT is just like one very small part of the state opiate response grant. There's like a ton of other programs that include like mobile health units in rural Colorado and medication assisted treatment options too, that they fund those sorts of organizations. So CRAFT, being one of the many projects of SOAR, brings together family members and friends of people with a substance use disorder once per week for 10 to 12 weeks. And the CRAFT training, or a trained CRAFT facilitator, guides participants through strategies that may increase positive interactions with their loved one who is struggling with substance use disorder. And like goals of this include increasing participants' well-being, providing participants with the skills and confidence to reestablish or improve the relationships with someone with an SUD, with substance use disorder, encourage their loved one to start treatment or continue with treatment. And I think a big thing too is that it helps folks increase their well-being regardless of what happens with their loved one, knowing that having a loved one with a substance use disorder is like very stressful and can really impact health. So just trying to improve well-being regardless of the outcome for their loved one. So CRAFT is, the trainers of CRAFT are through the Behavioral Health Administration. So they'll train folks across the state. Right now there's more than 25 organizations that facilitate CRAFT, and that includes folks at substance use disorder treatment and recovery centers, recovery coach agencies, private therapy practices, and community-based nonprofits. So our evaluation approach to CRAFT, we use the RE-AIM framework, which is used quite often in public health evaluation. So RE-AIM stands for REACH. So we're looking for data to help us understand who in Colorado is receiving CRAFT training and participating in CRAFT, how effective it is. So is it actually achieving the goals set out by the program? Are folks actually, improving their relationships and increasing their well-being? Adoption is asking and exploring like how different organizations are like including craft in their treatment options and how widely available it is, if it's something that's really embedded within their organization or not. Implementation is asking about whether or not like how the program is implemented. So is it like virtual? Is it in person? Are there differences between the two? Like do folks experience different outcomes based on if they attended in person or not? Stuff like that. And then maintenance is looking at, will this be sustainable even without funding, or what's the likelihood that it'll continue after there isn't funding anymore for the program. So to do this evaluation, we used a few different methods. We started with a logic model, which is just mapping activities to outcomes for different programs. We do, and this program has been going on for, well, the evaluation of this program, I should say, is in its 4th year. So we're doing, we do in-depth interviews with facilitators and participants every year. We have a participant outcomes and impact survey. We analyze administrative data that helps us understand the reach, and then we do geographic mapping to understand who's being, who is engaging in craft and who's not, and why, and if there's gaps that need to be filled in outreach and accessibility. Any questions on craft before I move on? Okay. The second of 3 examples I have is Mountain Sentinels. So Mountain Sentinels is through Colorado State University. They are a group that was awarded a grant from the National Science Foundation under the Accelerated Research through International Networks Collaborations program, which there's many different grants that folks can apply to through NSF. But the intention of Mountain Sentinels is to center local and Indigenous knowledge, practices, and needs to guide research and activities focused on mountain resilience and sustainability. So I love this program. It's been so awesome to hear stories about researchers and Indigenous communities coming together and learning from each other. The Alliance consists of 5 PIs and a project manager, 16 partner organizations that are throughout the entire world on all 5 continents, I think. And then there's also regional representatives and practitioners who are partnered with these global organizations to really ensure we're including, of course, the main part of the grant is the community voice and the Indigenous communities. And then early career researchers and practitioners from all these different communities as well, who we call the program fellows. So the evaluation approach, we've done a ton of different stuff. We do use the collective impact framework, but I would say that's just a portion of it because the collective impact framework is very Western thinking. And since we are working with Indigenous communities, we've definitely expanded our thinking into different ways to define success other than collective impact. But since the goal of the NSF grant is really around collective impact, we focus on that too. So just kind of understanding how the backbone function, which is the project team, has built and maintained the Alliance, how different different hubs across the world are learning from each other and engaging in activities that they've learned to improve like resilience and sustainability in their mountain communities, how the Alliance is communicating with each other, what their common agendas are, even though they're all like globally different and in different areas, they're all mountains. So like what similarities do they have there? And then how are they sharing their learning? So to understand all of this and more, we've done a lot of observations and interviews with the PI team and Alliance members and community members. We do surveys when it makes sense to do that. This one's like very challenging because it is so many different cultures and languages. But so I think a lot of it, most of our data probably comes from observations of attending like events, and then hearing the community members and the PI team, just their reflections and storytelling of what's happening in the Alliance. I'm really excited about supporting this project because of my passion for environmental justice and sustainability. And of course, just the focus on Indigenous wisdom and knowledge. Yeah, I've loved this one. Okay, the last example I have is our Caring for Denver Foundation contracted work. So Caring for Denver funds hundreds of organizations and nonprofits in the Denver area who have programming that supports positive mental health and well-being, youth-focused positive programs and activities, alternatives to jail programs, and programs aimed to prevent and treat substance use disorder, all in the Denver area. So we are contracted by Caring for Denver because they have an internally embedded evaluation team of 3, and so they each have like 100 grantees they're working with, that they have to get data from a requirement to report on, you know, how they're funding different organizations. So they just don't have very much time. So they contracted with us to provide technical assistance and support to grantees to kind of like get them to the next best place in their own internal evaluations. So we provide free evaluation support to Denver nonprofits through this. We help them to develop or improve their evaluation efforts so they can effectively communicate the impact they're having on their communities. So we really, through this, we meet the grantees where they are. We tailor our methods and approaches to fit their needs and the resources they have to make sure that like whatever we do with them is sustainable once we're done. We have only around like 15 hours or so to work with each grantee. So we really try to make the most of it and make sure they build their capacity first and foremost. So we do a lot of consultation and evaluation planning and design. We build that like logic model that's just kind of their roadmap of activities to outcomes, and then how they're going to show that through an evaluation, what data they need to collect. We'll help them develop data collection tools. And then I think one of the biggest challenges that nonprofits face is like once they've collected data, how they analyze and report it. So we've helped develop a lot of like automated dashboards to just make that process easier and straightforward for them. A lot of Caring for Denver grantees have programs that are intended to support immigrants. So I'm really happy to be supporting Caring for Denver and these organizations. They're the advocates, they're the practitioners, but I can still support through evaluation and helping them tell their story and get funding to continue supporting their participants and their community members. I would say my training in anthropology really helped me to be a leader in culturally responsive and equitable evaluation at the Evaluation Center. And I think like part of the reason that I was chosen to work on the Caring for Denver grant is because of my background in medical anthropology and the training I received around just equity, social justice, and like qualitative methods that are not harmful and not extractive. So yeah, the end.
Thank you.
Yeah.
I just had a quick question for students who might be interested in going into evaluation and might sort of struggle with the challenges of explaining what an anthropological perspective contributes. Like, how do you frame it to the evaluation center? And I imagine they are likely even more aware of anthropology because of their affiliation with the university. So what are the ways that you communicate
Yeah,
anthropology contributes?
I would say just like really focusing on qualitative first and foremost, because I think a lot of folks who are trained through different there's like an evaluation methods course or like master's program I think here, but I think what anthropologists really bring is that expertise in qualitative data collection and analysis, along as well as like the quantitative work too. But I think really focusing on the qualitative component and just like like I mentioned before, the focus on like equity and social justice and like reflexivity is huge. I think a lot of like prior to myself and my coworker Liz, who also went through this program, going to the evaluation center, a lot of evaluation work was talked about as being like objective and like you don't have your biases when you're collecting data. And it's like, well, that's impossible. And so like really understanding how you show up into a space impacts the way you collect data, I think is huge. And we learned about that. That was like a major thing that I remember learning here. So I think, yeah, focusing on qualitative data collection ethically, responsibly, culturally responsibly, and really bringing that reflexivity piece is huge. And then like focusing on, I think I mentioned it briefly too, but also like how frameworks and policies impact applying those to like real world situations. And we did that so much in like reading the different ethnographies and thinking about like world systems and like social systems and how that impacts like people and lives and health. I think having that background has been really helpful too, in thinking through like what questions do you ask and like how do you understand if something's benefiting someone, if a program is benefiting someone, and who is it benefiting and who is it not. So all of those things.
Thank you.
Yeah.
Question about how you're seeing AI sort of enter the workplace in sort of whether it's, you can categorize it like positive, negative, neutral, or just, yeah, like what it's doing, or and what you're like, what you find helpful, but also what you find concerning.
For sure.
Yeah.
Yeah, so that's actually a really good question. We, for our Caring for Denver grantees, were actually myself and Liz. It's funny that it's me and Liz all the time, but we are doing a workshop with grantees around like qualitative, it's like a four sessions over like 9 months, all about like qualitative data collection. And one of our we're doing it this upcoming month is about AI and evaluation in AI. So I've been taking some like trainings or webinars around like how a culturally responsive evaluator can use AI. So I'm by no means an expert, but I will say how would I even feel about it? I don't know. I have a lot of issues with AI. I think like first I can like go through, the environmental impact of AI is huge. So with that, always thinking about like the way and how you use it, and if you really need to use it for something, and making sure that you're not using it for things that you could easily do by yourself and wasting resources. So that's like a big one.
You find like external pressure coming up, like are you starting to see sort of like an assumption that, cost benefit, it makes more sense to use it?
So far we have not, and we honestly, like as an organization, we like are talking about having those conversations about how we use it. I mean, I think the whole university has Copilot, right?
Yeah.
And then now we're getting ChatGPT.
Yeah.
And I would say like a lot of our grantees, like in our learning cohort with the grantees, the reason we're even bringing up AI is because a lot of them said that they've used it. Like they'll have like an open-ended survey and then just like pop the results into ChatGPT.
Mm-hmm.
So we've had a lot of conversations about like using a paid versus a free account and how they take and use your data, and like would you feel comfortable telling your participants of the survey that you're going to upload their information or their responses to ChatGPT? And also that like we did a test. So as an organization, we don't use ChatGPT for like qualitative analysis at all. I would say we mostly, and I can't say we, I guess I do not like AI, but I do understand the benefits of it to some degree. So like I'll use it to help, like if I like am writing coming up with like interview or survey questions, I'll like kind of come up with my own, and then I'll say like, okay, here's what I came up with, here's the program. Is there anything I'm missing? Like, do you have any other examples or of questions or something like that? So like I'll use it for stuff like that. But never, or another like thing I've used it for a lot is getting like Excel formulas and be like, I need a dashboard that helps me do this. What's the formula? That's really helpful instead of like Googling it for hours. But we did a test one time. We like had all these interviews for a program, and we like did all the coding ourselves. We de-identified it and everything. We did the coding, we had our outcomes, and then we like put it in ChatGPT. And the first person that just happened to be the transcript that was uploaded first was like, this project is great. I loved it. And they were the people who like developed this reporting process. And then everyone else were kind of like, oh, there's all these issues and blah, blah, blah. But the outcome was that it was positive. And it was because like it went off of the first transcript that was imported. Yeah, so it was like very wrong. And like since then we've learned, you know, like it would be best to use if you are going to use it, then use like Notebook LM, like really decide like what is the AI tool you're going to use. Yeah, like don't use something that like this AI is made for everything to do like qualitative coding when there's like a specific qualitative coding AI. Yeah, so that we learned. And then also just like providing context, like it's not going to know what your program goals, worldviews, values, the lens that you bring, the background of your participants, unless you tell it. So like if you are going to use it, then like I think in Copilot it's called like an agent, or like in ChatGPT it's called a project, but create one for like your program so it can understand already, yeah, like the worldview and values and everything. And then you can tell it to like, also make sure you tell it, because it'll make things more positive because it wants you to keep using it, and it's like market, right? It's trying to get money. So it just wants you to keep using it. Yeah. So it's going to be more positive. It's going to flatten things. It'll, like instead of giving you the detail and the outliers, the N of 1, it's going to totally erase those responses. So like sometimes you have to say, I mean, I'm not going to use it for qualitative analysis, but saying like, you know, what is an outlier, or what you can ask it to tell you what someone said, an experience that someone had that no one else did. So it'll like tell you those things. So yeah, like if you're I would say, I think as an organization, we're like, yeah, data privacy too, like only use paid programs, don't use free ones, and understand like where the data is going, and make sure you update like I think it automatically will say it's going to share your data, but if you pay for the account, you can change that setting. So just like making sure that's always up to date. I think we're kind of like, we know we have to start using it to some degree, and you know, because we're hourly, so, or our rates are hourly. So it's like, if we don't start using it to, you know, increase our capacity and resources, then that's not going to be good. But we all are just like, but no. So I don't know. I would say there's probably a push in evaluation to start using it ethically and in a way that like, yeah, especially for low resource organizations too. I think another thing that we're talking about is like, okay, if we're going to use it, then how do you use it in a way that like, it will help you do certain tasks faster and leave you with more time to build your relationships and communicate, and have more time to like think through deeper things and collaborate with your colleagues. So it's like, yeah, what are the things that can help us do quickly that don't matter as much, so we can spend more time doing more things in a more like equitable manner. But yeah, they're all very it's scary. I don't even know. It is. It's so crazy. Yeah.
So interesting. I had no idea this job field even existed. So this is my experience of all of these. Like, oh wow. completely different, but that's really fascinating. And it's great to hear you talking about the fact that you get to continue to like learn and grow.
Mm-hmm.
So
Mm-hmm. Yeah. I love it because we have so many different projects. So it's always a new content area. So we always get to learn about new things. Like I'm not on this project, but some of my colleagues are working on like a university-based, I think it's an NSF teaching grant. And it's all about CRISPR. So they're like learning about CRISPR and like gene editing. Yeah. Yeah. So it's just, it's cool that we get to learn about new content areas, new methods all the time, work with different people. So yeah.
That's so awesome. I hear a lot from some of my colleagues who went like the more applied practicing route after graduate school about implementation science, which is like this growing area, as I understand it, that is sort of adjacent to evaluation.
Hmm.
Do you know anything about it? Or
Implementation science.
Yeah.
No,
Okay.
I have no idea. I have not heard that.
yeah. Anyway, I was just curious to pick your brain about sort of the differences and the similarities, but it seems to be like another major employer of folks with qualitative and ethnographic skills.
Interesting. Okay. Yeah. I don't know what implementation science is.
Yeah.
Mhm.
Yeah. Well, thank you so
Yeah.
much.
Mhm. Yeah.
Yeah.
I'll stop sharing and end the
are we putting these